Hi everyone, happy Friday. I just got back from doing a bunch of medical stuff, blood work, talking to doctors, going over scans, making new appointments, all the fun stuff. So kind of made me want to do a video. It makes me feel a little bit more connected to everybody, I think. As we all know, chronic illness can be very isolating. So just feeling like you have a family behind you for support is always really, really important, and it's a huge, huge help to me always. So I want to talk about doctors and how crucial it is to find the right one. I've done a bunch of blog posts about it, and I've tweeted about it, and anyone who kind of follows me on social media knows that I've been having a little bit of trouble finding a GI. I've been using my colorectal surgeon as my gastroenterologist for over 10 years because a lot of my issues were surgical, but I had made appointments with other GIs. I met with them, and I just never felt like they understood, and my surgeon always understood. So I kind of just figured, why not just have him as opposed to finding someone new? And now that I'm dealing with things that are not surgical, it's not really appropriate for me to be seeing him and for him to actually be treating me. I feel very, very lucky right now that I have a good medical team behind me. I'm finally seeing a GI that I really trust, that listens, that gets it, that is not minimizing what I'm going through, and just I feel like it's sending me for the right things. And I feel very, very good about that because obviously with a IBD, finding somebody local, especially when you have a complicated case, which I think most of us do, it doesn't go well. And then they're not affiliated with the right hospitals, and then you deal with the hospital staff who has no clue what Crohn's disease or ulcerative colitis even is. That's a whole issue in and of itself. And anyway, I feel really good that I found, and I don't like jinxing things, but I found a doctor that I do really trust and I do think is very much on his game. And I also have a doctor that I've been seeing for sleep who's kind of become my new internist in a way. I don't have sleep apnea. I suffer from the normal insomnia and painsomnia and all the things that I think most of you guys suffer from. So he could have very easily said, that I'm not really the right patient for him, or actually he's not really the right doctor for me is better wording. But he has continued to treat me for over a year, and he's led me in a direction that no one else has even thought about. And it's because of him, and he's another person who is just such a human being, takes the time to really listen and not just, jump to conclusions or, just make snap judgments and think they know things without really understanding and all that. And him and his nurse, his office staff, they've gotten me scans that have taken me, 3 weeks to do on my own, and just, they've gone above and beyond, and I appreciate it so much. And I have another doctor that I just got off the phone with who is setting me up with a surgeon, unfortunately, but at least I trust her very, very much, so I trust her recommendations, and I at least feel like I'm getting to the bottom of certain things. And, the worst thing, for me at least, is just the unknown. It's just the not feeling well and having no answers. At least with answers, not that you want, to get back anything awful, but you want to if you're not doing well and you already know there's something wrong, hearing that, nothing showed up on this test, or they're not finding anything, or nobody has a clue, it just makes you feel hopeless because you know that there's something wrong and you're not feeling well and you're not functioning like, the person that you want to be. And it can make you feel like, well, maybe my situation is psychological. There's no doctor that can help me. So, I wanted to briefly just talk about how much more empowered I feel now, and how much better I feel mentally, I guess, that I feel like I have a pretty good medical team behind me. And it's definitely taken a long time to find these people. It's comes with a lot of frustration, a lot of, things that nobody wants to deal with, but it's really, really so important. And I think after leaving my GI appointment, it was about a week ago, I walked out realizing just even more than ever how important it is that I'm with doctors that I trust. As most of you know, I've been a chronic illness patient since I was 13 years old. I'm 28 now. I kind of know the deal already. I know my body. I don't know everything. I don't claim to know everything at all, which is why I need really good doctors, on my side and listening to me. And it's just, I always knew how crucial it was because, I've mentioned so many times my surgeon saved my life. He's a person. I would go to him for pretty much everything. He's actually the person that got me in to see this GI. So huge thanks to him. I won't say the name, but anyone who is looking for a colorectal surgeon and lives in my area, feel free to message me. I just, like I said, I left that appointment and after getting off the phone with my other doctor and my appointment yesterday and just going through all these tests, I at least know that the tests I'm going for they're for a purpose. So many times I felt like doctors were just sending me for things. I didn't even really understand it or it didn't add up to me. And, of course you go through the tests and they're traumatizing and no one wants to deal with it. And you're dealing with insurance companies and then you're dealing with more doctor's appointments and you're still not getting anywhere. And that's just insanely frustrating. So I at least feel better that, I need to take a step back a little bit and stop trying to be so in control of everything. I know that, it's kind of human nature, especially with a lot of the things that IBD patients deal with. We deal with doctors and other people in the medical profession who really have no idea what, inflammatory bowel disease is. So when we walk into a hospital or when we start with a new, doctor or doctor's office, you're starting from scratch and it's frustrating beyond words and you feel like you need to, or at least I feel like I need to be on top of everything because no one else has a clue what's going on. So to have somebody in your corner, I guess I'll say, that you do trust and that this person is ordering this CT or this small bowel series or blood work or whatever else it is, and that there's a reason for it and you trust that person is not just sending you willy-nilly for tests, it makes a huge difference. And it makes me way more likely to do them. I mean, I didn't, I'm going away for a little while. I didn't need to, rush to get blood work, make appointments and all this stuff. I didn't need to do that. And I honestly probably wouldn't have done that if I didn't have doctors on my team now that I trusted were doing right by me. So I don't want this video to be hours and hours long, which I could talk about IBD and all these things for such a long time. But I really just wanted to emphasize again how important it is that you have a doctor or doctors actually that understand you, that you're comfortable with, that calling for certain medications, it's not a fight. Their office staff, they get back to you. They all these things. I mean, living, as most of you know, with a chronic illness is so hard. Just in and of itself, every day is hard. So having doctors and medical people, I guess I'll say, making it worse is just like mind-boggling to me. It makes my brain want to explode. And I've experienced that all too many times. So I just wanted to briefly talk about where I am in terms of doctors and what I feel about, the medical profession and all that. And, I welcome any feedback and comments. And I know a lot of you are struggling to find the right doctor or situation. And, it's really hard. And, there's so many times where I look to my, fellow IBD patients for advice on tests and things like that because I know that they've experienced it and I trust them. And a lot of them more so than some of the doctors I've seen, which clearly is a problem. So anyway, I will leave you with that thought. As always, message me, Marisa at journalingibd.org. If there's a topic or anything that you want me to talk about, just let me know, or if there's anything related to this topic that I'm missing or think should be addressed. Again, just please let me know. These videos I do obviously for myself to kind of get it out, but also for everyone else and to let people know that they're not alone with whatever struggles they're dealing with. So, all right, I hope everyone has a great holiday weekend.